Welcome back to the Gundry MD YouTube channel. Today I want to take a few minutes to answer your questions. I love hearing from you, and putting together videos like this one is one of my favorite things to do. So stay tuned, and if you've ever left a question in the comments, I might be answering it below. First up, I eat soups with cooked leafy greens instead of raw leafy greens. Isn't it better? Well, that all depends. Many of my patients, particularly with irritable bowel, leaky gut, autoimmune issues, really don't tolerate particularly dark, raw leafy greens. It upsets their stomach, it gives them diarrhea. So cooking those greens intensely actually makes them easier for you to tolerate. And so I really kind of keep raw leafy greens away from those people. On the other hand, raw leafy greens are a great way to add both olive oil and vinegar into your diet in a very tasty fashion. And both of them are great for improving your gut health and uncoupling your mitochondria. Better yet, cook your leafy greens and then pour a bunch of olive oil on them and eat them like soup. Throw them in a blender. Next, has anyone here tried bone broth for gut health? I honestly cannot tell if it is worth buying. Well, quite frankly, I don't recommend bone broth. Unfortunately, a lot of the bones contain arsenic, and you're going to absorb arsenic and lead from bone broth, even if it says grass-fed or pastured. On the other hand, what you're really looking for in bone broth is collagen. And you can buy different sorts of collagen, but what you're actually looking for in collagen is vitamin C and lysine, which are the main components that make collagen collagen. So don't waste your money. Buy yourself some vitamin C and forget about the bone broth. What about decaf coffee? Does it have all the same health benefits as regular caffeinated coffee? Well, yes, particularly if it's water decaffeinated. You'll get all the polyphenols in regular coffee without the caffeine. Now, does caffeine have benefits? Yes, caffeine actually does uncouple mitochondria, but so does the polyphenols in coffee. So caffeinated coffee is a kind of a 1-2 punch for uncoupling mitochondria. But if you can't tolerate caffeine, and many people don't like that feeling, just have water processed decaffeinated coffee. But please don't put milk or milk products in it. You'll eliminate the problem. Do I need alkaline or hydrogen-rich water? Well, first off, you're wasting your money for most alkaline water. There's no evidence that alkaline water with a higher pH changes your body pH at all. It's such an infinitesimal amount of alkali, it's a waste of time. On the other hand, there are multiple studies, 1,000 to be exact, mostly done in Japan and Korea, that hydrogen-rich water really improves blood flow, improves mental health. Spend your money on hydrogen-rich water. And the great news is you can buy H2 Restore from Gundry MD, which is a little tablet that you drop in water and you'll instantly have hydrogen-rich water. Next question, what are some tips you would give to people starting a lectin-free diet? Well, the first thing you really want to do is get mischievous grains and pseudo-grains out of your diet. That's a great place to start. Particularly now, there are so many lectin-free grains available that you can have, like sorghum, like millet, like teff. These are lectin-free and they're so versatile. You can make oatmeal out of millet. You can make dressings, stuffings out of sorghum. We just made a turkey rice soup from leftover turkey using sorghum, and it tasted exactly like turkey rice soup should take. Additionally, there are so many great lectin-free pastas made out of sorghum, made out of millet, made out of green banana flour, made out of sweet potato, that you can now have what you want in terms of these mouthfeels without the issue. My sorghum Gundry MD pasta fools anybody into thinking they're actually having the real thing. Okay, that's it for today. If you got any more questions, please make sure to leave them in the comments below. Then keep tuning in, because I may answer your question in an upcoming video. Because I'm Dr. Gundry, and I'm always looking out for you. We'll see you next time.